Hi, I'm Emmett Grover, one of the therapeutic advanced endoscopists here at Boston Children's Hospital. Today we're going to talk about ways to access the bile duct and the pancreas duct during an ERCP. We have many different devices which we can use to get access to the bile duct or the pancreas duct, and we're going to focus on two today: sphincterotomes or tomes and cannulas. They both differ in many different regards. A sphincterotome has a cutting wire, whereas a catheter or cannula does not. These allow us to pass a wire and then the catheter itself into the duct of interest. We will shortly review how sphincterotomes can differ from cannulas, how they look, how they act, how to load the wires, and how to use the devices correctly. Sphincterotomes can come in many different sizes, many different tips, many different cutting wire lengths. It's important to check with your doctor or your proceduralist before choosing the right one. Similarly, cannulas come with many different tips, many different lumen sizes. Some can allow you to put wires, some can allow you to do contrast, some can allow you to do both. But again, check with your proceduralist beforehand, as these will be what you determine before the procedure and then how to maintain or gain access to the duct of interest. We're next going to move to one of our stellar nurses, Deanna, who's going to show us how to use all these devices.
Hi, my name is Deanna. I'm an endoscopy nurse, and today we're going to talk about how to access a sphincterotome. This is the Jagtome Revolutionary RX system. Here you'll find the wire size 0.025 and the length 260 centimeters. The important thing before opening any device is always make sure that the expiration date is accurate. You want to make sure before opening it that you lay it flat, and you always want to open the device away from you, making sure when you open it that you're not losing any of the equipment inside of it. When opening the device, you're going to open it towards you. You're going to look for the twist tie, and the twist tie pops off. You can set that aside and discard. You're going to open here. Okay, your next step is to remove the guide wire. Make sure that you stay in line with the catheter that's curved. You never want to straighten that out. Keep this aside for later use. Some physicians like to use it to poke the biopsy cap. You close this. You're going to pop this outside of the plastic. And discard the plastic. You're going to guide the wire to the tip. Making it flush. And you're going to pull the catheter away, making sure to keep this device here. This is an important piece. Keep it safe and discard the rest. Here you see the wire advancing out of the sphincterotome. This is an example of bowing or tension when the doctor asks. You want to make sure when he asks for tension that you're communicating that you're pushing in and communicating, giving tension, bowing, bowing, bowing until he tells you to stop. When he tells you to take tension down, you will slowly release and pull back, always slow movements, communicating that you are releasing tension until he says stop. You can see clearly here the wire. This is the cutting wire. After opening the sphincterotome and making sure the wire is flush to the tip, I'm going to prime the wire. What we use here is 50 normal saline and contrast, or whatever your physician orders, by attaching a syringe to the port and gently flushing, making sure that you see fluid come out the tip. And now you're ready. When your physician requests for sphincterotomy and needs heat, cautery, you want to attach this device, the sphincterotome, to a cautery device. You want to make sure the device is on. Here's your cord. You're going to attach and wait to hear for the click. You are attached and ready to go.
When the sphincterotome is ready, I'll often ask the nurse to hand it to me while the scope is in the patient. When I receive the sphincterotome, I will pass it in the channel of the ERCP scope and run it until the tip comes out of the bottom, as such. When ready, I will then ask the nurse to strip down the wire as such. Here, I now have access to the wire, and I can put it in my locking device and try and get access to the bile duct. Oftentimes, when we're completed or we have to exchange the wire and catheter, using good communication, I'll talk to the nurse and we'll slowly pull out the catheter and or wire with a small exchange. So Deanna, I'm going to start pulling out catheter. See how my wire stays secure because it's locked in right now and I know my wire is where I need it to be. Also note how Deanna loops the catheter for ease. Now we have to do what's called a short exchange, where I will disconnect my wire here, and as I'm pulling catheter, Deanna will help with my wire. Alright, so you'll do a small exchange there, push the wire, push the wire. Good, I have my wire. Perfect. Now we're going to move on to cannulas. Cannulas differ from sphincterotomes because they don't have a cutting wire, and many times they don't come preloaded with a wire. It's important when asking for a cannula to confirm with your doctor. This is an example of what's called the RX standard tip cannula. Many times cannulas can hold different sizes of wires. It's important to see here, and it'll often say on the packaging the size of the wire needed that you can load, as well as remember to always look at the expiration date. Deanna will now show us how she loads the wire.
Upon opening any device, verify that this is the correct device and the expiration date. You're going to open up on a flat surface and always open up away from you. Okay. Here, you'll pop off the cannula. And discarding the plastic.
There are many different types of wires that exist, so always confirm the wire with your physician. On the wire packaging, you'll see the size of the diameter as seen here, 0.025, the length of the wire, 260 centimeters. You can also see the expiration date. Some wires have coated tips, some wires are angled, some wires are made with different names. This is a Jag wire, there's ones called Dream wire, Glide wire, Visi wire. Your doctor will know the type of wire they would like to use, so always confirm. In this case, we know this is an 025 wire, which means it will fit in that cannula we just showed at, which was 035. Deanna's now going to load the wire. Often the wire will be in a tubing device like this, and once you find the tip of the wire, you can see it coming out the end there. It will often come with a tapered tip loader, which Deanna has in her fingers there, which she can then use to help facilitate loading into the catheter. There she is putting the tapered tip into the catheter, and then she will load the wire through that, which will then allow the wire to run into the catheter, thereby loading the catheter in preparation for the ERCP. Some catheters require you to flush with saline, depending on the wire type. Some do not. We often advise that you have a wet catheter and a flushed catheter, as well as a wet wire, and it will flow a whole lot easier. Here you can see the wire going through the catheter, and then it will eventually come out the tip, and then that is when the catheter is ready to be advanced to the procedure list. There you see the wire coming through the tip. This may be a little bit tricky because it's not wet, but you can see it's coming to the tip there, and now it's come out the tip, and this is ready to be handed to the advanced endoscopist or procedure list. This catheter is also part of the RX system, which allows the nurse to give doctor control, where we can strip the wire just like we did in our sphincterotome. Here Deanna is going to pinch the wire at the hub and show us how she strips it down to the tip.
Thanks for watching. We hope this was helpful.
Please like and subscribe, and we have other videos coming up for all the other devices that we're going to be using.